My name is Sanjeev Bhalla, and I'm a professor of radiology at Washington University, and I run the cardiothoracic imaging section here at the Mallinckrodt Institute of Radiology in St. Louis, Missouri. What we try to do is we will use the baseline study, the original study that allowed us to make the diagnosis that there could be a cancer, and we do the follow-up study and we try to measure the areas that were abnormal and try to compare if there's been a change in size. And this requires us to do measurements with electronic rulers to know if the thing that we saw on the original CT or chest x-ray has gotten bigger or smaller. That's helpful. And we do that looking at changes of size, and we often have to compare a study to the most recent prior, and sometimes we have to go to the prior study before that because subtle changes can sometimes be easily overlooked. We also look for other findings that might not be easily measurable. These would include some fluid around the lungs, which can sometimes be a sign of a cancer, and they may disappear when the treatment is working. We may see that there's sometimes some areas of tumor that kind of diffusely spread through some of the fat compartments of the body, and those may get better. And we also look for changes in the bone that may get better with treatment as well. I say that it's complicated because on the surface, it seems like you're just looking at changes of size, but we've also learned, especially with some of the newer therapies, with some of the antibody therapies, you may see a difference in the enhancement. So enhancement refers to if we give a patient IV contrast for the study, it's this liquid medication that's based on iodine. If we give a patient that medication, what will happen is that a tumor will have uptake of that contrast and will appear bright because it takes the iodine. And a tumor that's effectively being treated may not change in size, but may take up less of that iodine. So that's something we've learned as well. And so that's what adds to some of the complexity. And even more complex is some of the newer therapies, like the immunotherapies, may actually result in a slight increase in size on the first follow-up examination, and then on the second and third, things to get smaller. So this is where it becomes so important that when you receive the result of a CT scan or of a radiology study, to discuss it with your physician so that this can all be put into context so we can better understand, is this something that's an expected complication or expected finding in your treatment? And is the response something that is indicative that things are getting better versus getting worse?